talking about guns in the battle, right? No matter what we think our battle is, we all have one. Even if you're in a very top-notch job and you've got your face in front of a screen 4 to 6 hours a day, 8 hours a day, I don't know. I think you're in the battle. But I wanted to talk to you today about, and this might be a little hard topic difficult for me to get rolling, because I have feelings about it, but I've never really put them into words, you know? So what I want to talk about is the medicine versus a drug kind of thing. I'll say cannabis, for instance. Let me try again. Medical marijuana being legal in Colorado. It's awesome for me because I use it as a medicine. And it's been that way for years. I didn't even really realize it, that I was using it as medicine, until it became legal and I could get a red card to go get some. And it's awesome until your red card expires and then all your connections are gone. It sucks. Yeah. But that's not what I'm really talking about today. It's the attitude. The attitude about it. You know, I've never felt like I held an attitude about people's medicine. Occasionally, I guess I get a little judgment going when it comes to alcohol because of the drunk and inadvertently killing of other people when you're drunk, kind of, not you, but when that kind of thing bugs me. I think alcohol is a very, very, very strong drug because of that whole thing. That you can become inebriated to the point where you don't know what you're doing. Well, that's not what I'm talking about today. I'm talking about a medicine where let's say if you've ever taken a medicine that takes a while to build a level to, let's say cigarette smoking is one that I believe that to me is a medicine. My doctor asked me the other day, "Are you still smoking?" And I said, "Well, yeah, I smoke maybe 2 or 3 a day, 1 to 3 a day. But I use it as medicine." And she says, "Oh, okay," and was on, right? But people don't understand that idea because smoking is so ingrained in us to be a drug, right? Nicotine is a drug, and people who smoke are drug users, right? Well, and people who have, maybe they participated in pot when they were in college and they smoked a little weed or pot. It was pot back then. Weed today, maybe they smoked a little weed and got really high, because I'll tell you what, in Colorado, we're doing pretty good as far as growing. I mean, it is some good medicine. But if you have never done it before, or if you rarely do it and you smoke, you're gonna feel it. You're gonna feel it 10 times more than I feel it because of the levels that get built up. It's just like, antidepressants come to mind, where, initially you'll feel real good and then it'll build some levels and then, right? And to come off of that cold turkey or very quickly would be detrimental. Marijuana, cannabis is real similar. Well, in some ways. I mean, you can smoke once or twice or 3 times and you're going to get stoned. You're going to get baked. And any kind of, there's a million other words that I could use in that sentence, but what I'm trying to say is a person that uses it medicinally does not have those same feelings. When you use, say, when you take 3 doses a day, morning, noon, and night, let's say, for instance, it's going to maintain a level of THC or other things in your body, and then it treats you medicinally. Does that make any sense? So I would make it real complicated, say, for the vehicle department, the Department of Motor Vehicles, to figure out, or the police department to figure out, where's the line, because medical marijuana users have to drive and live, and such a prejudice against it. I mean, there are some people on some heavy duty drugs that it says right on the label, don't drive, guys, but now you got a job driving because they don't really have to tell anybody, or who knows. But what I'm saying is, it's a medicine, and it would be awesome if all of us across the country, around the world, I mean, around the world is probably much more open-minded to it, I imagine, in our country, but I guess maybe I'm a little prejudiced against Americans. I'm just kidding, you guys, I'm kidding. But yeah, I always want to help people to understand, which I don't. I really kind of keep my mouth shut in all respects. To understand the difference. Medical marijuana is something that is very seriously good medicine for morning sickness, for all kinds of things related to pregnancy, birth, delivery, and thereafter. It's good for the baby. I'm not talking about smoking your brains out. I'm talking about medical use, And I don't know, it's gained such a reputation over all these years with the prohibition that it has become like alcohol. And there are medicinal qualities in alcohol too, if used, very small doses and not all day every day. Marijuana, on the other hand, is kind of an all day every long in medicinal ways. So it's hard to understand or compare those two like they're the same, because they're really not the same. Coming from me, who has experienced both along the way, I've never really had a bad alcoholism habit or anything like that. But I've had a drink or two here and there over the years. Well, it's kind of the same thing. If you were to take 3 drinks at morning, noon, and night every day, maybe you would get a medicinal effect from it, I have no clue if I'm making any sense, but there have been people over the years, we'll smoke a joint together, and they're like, oh my God, man, how are you not just baked out of your gourd? And it's because I use marijuana medicinally, and there's a difference. It's like a glass of wine compared to using it to get drunk. You just have 1 glass of wine and that's all you have every night. That's medicine. Kind of the same. But we are so ingrained in our thoughts about judgment about addictions and whatnot. You know, addictions even to pharmaceutical drugs. There are people all over our country in every single walk of life that you would not suspect uses a narcotic. And it's because they use it all the time, that they can do it without you knowing it. And it actually helps some people work, you know? Like, maybe they have so much pain they wouldn't be able to work without these drugs, or they have so many different effects from their body that taking this pill makes it okay, right? What is the difference? You know, if you knew that a glass of orange juice in the morning and for lunch and at bedtime created incredible health for you, but for some reason it became illegal and you could not get that orange juice anymore. I mean, it's your medicine. And who really, I mean, even, I don't know, I kind of believe in drug addicts on the streets. If they can get their drugs clean and legal from the pharmacy or the hospital, why shouldn't you just be able to get whatever you want and use it like you want? If it kills you, then maybe that's what they want. That sounds cold and harsh, and I don't really mean it like that, but at all. But you know what I mean? I've been thinking about this one for a long time. I just have experienced some things with people over time where they don't have an understanding of marijuana as medicine. Now, what if the consciousness was different about a different drug? It was insulin. What if we were all kind of judging people who took insulin, you know? Like, you know, what? Why in the world would we ever want to attach judgment to something that helps people? Oh, that one so much baffles me about our country, about our people. I've been judged for years for taking my medicine. I never judged anybody for taking any ibuprofen, any kind of drug. They're treating themselves because they know what's best for themselves, right? Who are we to say that's not best for you, you heroin junkie? Who are, well, if they want to do that, I mean, why are there laws about drugs? Am I off my rocker here? You know? Anyway, thanks for letting me ramble. Yeah, I'll upload it. I'll talk to you hopefully soon. I might think of something else to talk about. So, love you guys.